Hello, my name is Kyunghwa Yu. I am presenting this YouTube video in order to help out caregivers who have Alzheimer's disease patients in their family. According to Alzheimer's Association, AD is defined as a brain disease that causes problems with memory, thinking, and behavior. Symptoms usually develop slowly and get worse over time, becoming severe enough to interfere with daily tasks. AD has been recently raised to a hot issue as humans' lifespan increases. In 2006, there were 26.6 million sufferers worldwide. Alzheimer's disease is predicted to affect 1 in 85 people globally by 2050. Although majority of people with AD are 65 and older, significant amount of people at early age suffer from early onset of Alzheimer's disease. By far, AD is not perfectly curable but can be slowed down by help of drugs. However, there has been a research that ROT, which stands for the Reality Orientation Therapy training with drug injection, may enhance rehabilitation of AD. So, what are the criteria of symptoms of Alzheimer's disease? Let's look at the following video from the Grey's Anatomy.
I'll have to get a couple of roommates, but it's home, you know?
Are you the doctor?
No. I'm not your doctor. But I am a doctor.
What's your name?
It's me, Mom. Meredith.
All right. I used to be a doctor, I think.
You were a doctor, Mom. You were a surgeon.
As you can see from the movie clip, Alzheimer's disease patients lose memories of lives that he or she has lived and even forgets their beloved family. Observing such attitude, many family members do get discouraged and stressed. However, can we, as a caregiver, help Alzheimer's disease patients in our family besides injecting a bunch of medicines? There has been a research that proves several activities that stimulate cognitive response facilitate rehabilitation of AD patients. A team led by Marcelo Giordano in Alzheimer's Center led a research in order to evaluate the efficacy of the combination of donepezil with an intensive ROT with active participation of caregivers. He selected 100 patient subjects with Alzheimer's disease whose mean age ranged from 75 to 80. The subjects are expected to show no major physical illness or disability besides dementia and no diagnosis of learning disability. The test subjects were allocated into two groups, Group A and Group B. 100 patients in both groups were equally treated with 5 mg per day of donepezil. 68 patients who were assigned to Group A were not only treated with donepezil but underwent a 3-week daily ROT and physical reactivation training with the help of the caregiver. 32 patients who were assigned to Group B received only donepezil therapy. Group A patients performed various exercises with help of caregivers in order to stimulate cognitive ability. Over 3 weeks of training session, patients attended regular daily 45-minute class meetings involving presentation, repetition, and use of orientation. Also, caregivers participated to a 1-hour meeting led by a physician with detailed information of ROT methodology. Caregivers performed ROT activity on Sundays during 3-week intensive program and received explanations on how to approach the patient and practice the exercises at Alzheimer's Center. At the end of the training session, all subjects were tested for cognitive and functional ability. MMSE, ADAS, COG, number of impaired ADL, and number of impaired IADL, and PPP data were used to assess cognitive and functional ability. As the table shows, MMSE score increased from 17.1 to 19.6 at the end of the 3-week training period in patients who received both donepezil therapy and ROT training. MMSE score further increases up to a mean of 20.8 after 2 months of follow-up. In contrast, Group B, who did not receive ROT training but received only donepezil therapy, did not show any significant change in MMSE. ADAS-COG data also significantly changed in Group A. Number of impaired ADL and IADL did not show any change in both groups. From the result, it is proven that the combination therapy with donepezil and intensive program of cognitive rehabilitation with ROT and physical reactivation session performed better than patients who received the donepezil therapy alone. Also, from the ADL and IADL data, it is assumed that patients with mild and to moderate Alzheimer's disease will be benefited from the rehabilitation program. ROT, which stands for Real Orientation Therapy, is a type of therapy frequently used in care of demanding elderly, especially for the Alzheimer's disease patients. 24-hour ROT is the most famous real orientation therapy type, and it is a continual process whereby staff present current information to the person in every interaction, reminding the patient of time, place, and person, and providing a commentary on events. Since ROT is a verbal and interactive therapy, it requires a specific tactful strategy to approach 80 patients. And the strategy includes various factors such as use simple sentences, speak clearly, speak slowly, repetition of correct information, give praise, keep the conversation within a specific context, the tactful refusal of a patient's excessive or unreasonable demands, and avoid baby talk. So using this strategy, we can successfully approach 80 patients and perform the ROT so that we can help the 80 patients. And I believe as a caregiver, if you guys perform this ROT procedure with the help of drugs, I think we can efficiently help 80 patients. As the research shows, daily ROT and physical reactivation training with the caregiver will help rehabilitation of AD patients. It is not an easy task to interact with dementia patients, but if you approach with a tactful strategy, several exercises that simulate cognitive function will have a synergy effect to donepezil therapy. If you want more information on ROT therapy, please see a physician or expertise on AD disease near your place. Thank you for watching my video.